Okay, welcome everyone to Chicago Autism Network's virtual parent workshops. Tonight, we are very fortunate to have Marla Root speaking with us. Marla Root is the founder of the Illinois Autism Insurance Coalition. She has deep experience as a parent, an administrator, and an advocate in supporting families, providers, and state agencies. And she helps them to just ensure that access is available to the needed mental health services. She was awarded the 2010 Advocate of the Year by the Governor's Council for People with Disabilities. And in 2018, she was given the Implementation Award from Autism Speaks. She is the proud parent of Eli, who's age 24 and has severe ASD and intellectual disability. So I will turn the time over to Marla.
Hello, everyone. Welcome. So glad to be here tonight. I'm excited. It's always wonderful to work with parents and providers and all kinds of stakeholders. So excited to be with you guys tonight. Can you guys see my, Kim, can they see my screen okay?
Yeah, looks great.
All right, perfect. All right, so what we're going to talk about today is navigating insurance for individuals any age with autism, and it's a really about insurance, which it's kind of a dry subject, but so I've been trying to lose some weight recently, and just with the long winter and stuff going on with COVID and quarantining, I threw some fruit into our presentation to brighten our lives up a little bit, but I've also been trying to eat some more fruit more, so it's kind of a way to motivate me as well. But just like I said, so glad to be here with you guys tonight, and let's get rolling. All right. So as Kim said, that I'm a consumer of services. This is my son, Eli Root. He just turned 25 a couple days ago. Eli is severe on the spectrum with a severe intellectual disability. He is a wonderful, happy gentleman these days, but during the teen years, we had a lot of challenging behavior. I think I've used every type of service you can think of. And but he's just lovely today, so stable today and happy. He lives out with 3 roommates. They do some volunteer work. They have staff that support them. So we're just so proud of Eli, and a lot of hard work, as you guys know, those of you that are parents. And so I worked in the field of autism. I was an administrator of a community mental health center serving people with autism, did some work with the Autism Society, and that's when I really, once we passed the mandate, right, it was like, hey, how are we going to help parents figure this stuff out? So that's when I decided to start the Illinois Autism Insurance Coalition and try to move things forward, not only to help parents and stakeholders, but individuals with autism too. All right. So I want us all to have some fun tonight, but I want to make sure that you walk away with a gem, right? Something new you didn't know before, or maybe just something that we talk about brings something around full circle for you, and you're like, hey, okay, I understand that better. So we're going to talk about types of health insurance tonight. We're going to talk about, what is the status of the Medicaid benefit to cover applied behavior analysis? What is mental health parity and what protections does it give us? And then we're still going to talk about a list of barriers that we still exist, or sometimes we would get a denial from an insurance request for services. So gems are important, right? And plus they're bright and cheery for this time of the year. All right, so let's talk about the type of health insurance that we have or available to us. Sometimes we have it through our employer. And so that would be the top section there, where you may have self-funded plans. These are very large employers. Normally, these employers, they don't have to cover ABA or applied behavior analysis, autism specific treatment, but now 65% of them do. And many of them do now because of the advocacy work through families, really, and coming in and saying, I have a child with autism, I need access to this critical treatment. So self-funded plans, again, are very large employers that do not have to follow a state mandate, but thank goodness they're beginning to come along way to really support families. Then we have fully funded employer plans. These could be large, medium, and even small employers. Now they do have to follow a state mandate. So obviously we have Brianna's Law in Illinois, which is a state mandate. So they would have to follow that law. And then we also have our Affordable Health Care Act, or ACA. And in Illinois, we call it Get Covered Illinois. And so small businesses can purchase plans off the ACA or the marketplace, and they have ACA protection. So they would have benefits as well for treatment services there as well. The second group down, these are union, multi-employer, self-contractors, and like kind of related groups that pull together to create a health plan. So if you're a plumber, you may join up with many, many other plumbers who have their own business, and now you have a union-sponsored or a contractor-sponsored health plan. So these plans, either a union-sponsored plan or a multi-employer welfare plan, an association health plan, these plans don't usually cover benefits for at least applied behavior analysis, and we'll talk about that treatment here in a little bit. So a little slimmer on the mental health benefits in these types of plans. And this would also include the healthcare sharing ministries plan or a farm bureau plan. A lot of them cover no mental health services. So just kind of be aware of that. The third group down we have are the individual and family plans. These are purchased through a broker. So if you have your own business or you work somewhere and they don't offer a health plan, you could purchase an individual plan for your family unit or an individual plan for your child through a broker. So you can do that as well. And so there's some short-term gap plans if you're in between jobs that really do not cover mental health services. And again, you can also purchase these types of plans on the marketplace through the ACA, the Affordable Health Care Act, and that's called Get Covered Illinois, and they do follow the benefits. And then the last we have here are public health insurance, so Medicaid. So the good thing is Medicaid in the state of Illinois has started their benefit for applied behavior analysis treatment. So we're going to talk about that in a little bit. And Medicare would also be a public benefit, but Medicare does not cover mental health treatment like applied behavior analysis for kids, and they don't use it for adults either. So if Medicare is the only insurance that you have for your child, usually you can be dual eligible Medicaid and Medicare. Okay. So those are the type of health plans we normally see people getting access to health insurance for their families. Okay. So these are self-funded plans. These are large companies who now offer the benefit for applied behavior analysis treatment for people with autism. So it's just a fun visual that you can see here. And so sometimes, right, it may be beneficial to become an employee of these plans to get access to a benefit. But we're just so thankful for these plans for jumping on board and supporting our families. So how do you know what benefits are available in your health plan? So I think, going back to that first slide we talked about, you need to find out what type of health plan you have and where you fall on that chart is the first thing to do. But then you also want to either talk to your HR person or your insurance carrier and kind of get the plan description, right? The statement that tells you what the benefits are that are offered. Sometimes self-funded plans, remember those large plans who do not have to follow state autism mandates, they can exclude autism out of their health plan. So it's important to get that plan description, those benefits, so you understand, is autism covered and how is it covered? Sometimes the other thing to know is there's medical necessity criteria. And then there's certain covered treatments and not others that are covered. So, and all this can vary by the plan type. So knowing your health plan, self-funded, fully funded, a union sponsored, Medicaid, knowing what type you have, and then getting the plan description or the health benefit package for the plan. So you can look up individual treatments to find out what's covered. I'm not switching. There we go. All right. So what are normal covered treatments that we find for individuals with autism spectrum disorder? Usually the ones on the left here would be applied behavior analysis, counseling, social skills group, medication management or psychiatry services, occupational therapy, speech therapy, and physical therapy type services. So those would all be outpatient type services that we normally see. And then under the beautiful red cherries that are cheering us up tonight, we have more of our crisis, right, or stabilization type services, where somebody may need access to inpatient psychiatric hospitalization. My son did that. You may need to access partial hospitalization or like a day treatment program. My son utilized that service as well. Or residential mental health treatment. And this is where somebody who's in a significant behavior crisis needs to go somewhere to live for a short period of time to really stabilize before they can come back home. And unfortunately, my son had to use that too. But these are all wonderful services that support individuals with autism getting access to the care they need when they need it, right? And all of these services have a level of care. There's some sort of level of care that's happening there to determine what the individual needs, but then there's also a medical necessity definition they have to meet to get access to the service. So we'll talk a little bit more about that coming up. What do I do if my employer doesn't provide ABA treatment services or other treatment services that I may want to access for my child with autism? Well, we'd want you to advocate to your employer and really share with them what autism is, what treatment needs are needed for autism, how it impacts your family specifically, right? And share with them, because sometimes these employers, they just don't know. So it's a great opportunity to educate your employer and kind of become in a partnership with a team effort with them, right? So that's one thing you could do. If the employer decides, well, we're not going to add the benefit, you could ask them for a rider on your health insurance through your employer that would cover only your child. You could ask and see if they would be willing to provide that. We've seen that happen in the past, especially with kids maybe with high significant dangerous behavior, self-injurious behavior. So it's always worth asking, but we always want to add the benefit for everybody and educate them why it's best, not only for the families they, have engaged in as staff, but also, staff can come to work when things are working well and we're getting access to the right services and treatment that our loved one needs. So it's important for employers to understand that. You could change employers to employers who do cover the benefit, right? So these blue links here are links, and then I also wrote the link out for you just in case, but you could go to Autism Speaks has a list of employers and they're big employers who do cover the benefit. As you can tell, we put a couple here like McDonald's, Starbucks, Amazon. But so you may need to make a job change to help find access to those benefits. Now, we really don't want families doing that and disrupting the family, but sometimes, unfortunately, if our big self-funded plan doesn't cover, or I'm in a union or so forth, that may be something you would have to do to get access. The other thing you could do is you could purchase an individual family plan or even just a child-only plan, either through the Affordable Health Care Act, ACA, marketplace plans in the states, or through a broker where you're just going to do an individual child-only plan in the general insurance marketplace. Okay, so there are options, and these would be your options if your employer doesn't cover a benefit for you. So let's talk a little bit about autism and how it interacts with insurance. So autism is a medical condition that is listed in the DSM-5, right? So this is the manual, and it is listed as a mental health disorder. So it falls under the protections we find under health insurance for behavioral health services. And when we talk about autism with health insurance and the interaction, it sometimes sounds a little not very nice or not very human, or we're not talking about abilities, and which we all want to talk about. But unfortunately, when you're talking about health insurance and the interaction with mental health and autism, you're really talking about the deficits of the disorder, right? So there are 3 core deficits of autism spectrum disorder: social interactions, communication, restrictive, repetitive, and stereotypic behaviors. Okay, so when you're seeking treatment that would be funded by insurance, you're going to be addressing those 3 core deficits of autism, and it's just the way we do it in insurance, right? So if you need if you hurt your back, they're going to have to assess your back. find out what is wrong, right? So whatever the disorder, the condition is, and then once that's determined, there'll be symptoms underneath that type of condition um, or disorder, and that's what will be treated. So it's treated the same way on the medical side. So the intent of insurance funding treatment for autism is to rehabilitate, right, towards a less intensive treatment service or completely out of treatment, right? Or it is to maintain stabilization. So my son, for years, when he was a teen and we were going through these behavioral crises, we were just working to get to the point where he would need constant treatment and support just to maintain, just to stabilize him, right? And to keep him stable and keep him functioning okay. We weren't really making large gains or skills during that time. We were just maintaining functioning. So sometimes we look at treatment as rehabilitative, right? You're gaining skills, you're doing well, you're stable, and now we're going to move from an intensive treatment to counseling, or the individual needs access to treatment to maintain stability. All right. And of course, we know that, right? Every family and every individual with autism is different, right? So depending on, right, the needs of the individual with autism, the professionals they're accessing, and what those professionals are recommending or prescribing will determine what type of treatment they receive. Some people need little treatment, some people need a lot of treatment, depending on where they fall on the spectrum and what their symptoms of autism are. So just know that, there's lots of people out there whose child with autism just gets counseling, or maybe gets a little bit of applied behavior analysis, or maybe gets a lot of applied behavior analysis, or maybe is just great with some social skills group. So it is a spectrum, and that spectrum needs to be respected, that parents have choices. They work with professionals out in the field, and they're driving their healthcare for their child, right? So even though we may talk a lot about applied behavior analysis or ABA today, just know that this really applies to any insurance funded service or treatment you may be accessing. So here's a little bit more information about Get Covered Illinois, the marketplace. The marketplace is now reopened due to COVID, with so many people losing jobs. So it is open now through May 15th. But then also you can join the health plan at any time normally, if you have any of these 4 events. You got married, you had a baby, adopted a baby, or maybe a child foster care comes into your home, you've gotten divorced or legally separated, or you lost your health insurance, and death. So I just want you to be aware that the open enrollment is back open until May 15th for this. And you can purchase a child only plan. So this would be a plan that you would be specifically for your child only, and child only market plans have a applied behavior analysis benefit, speech, OT, and things like that. So it's important to know these are available to you. So we actually do see some families who have a self-funded health plan through their employer who does not have a benefit. And then they go over and they'll purchase a child only plan to get access to more insurance coverage. So it stinks that happens, but sometimes that does happen. So let's talk about the money, right? Here's my guy here throwing money. Unfortunately, right, as you know, when you go to the dentist, you go to the doctor, there's either co-insurance, there's a co-payment, and it would be the same thing when we talk about treatments for autism, right? So it's really important when you're getting your health plan document, you're understanding, what are my out-of-pocket expenses? What are my co-insurance, right? Which is normally a percentage, or what is the dollar amount of copay I got to pay every time I go do a visit? What is, how much out of pocket for the year? How do I find out if my providers are in network, so I'm getting the in-network benefit, right? How do I file an appeal if you deny a service that I may need? And then just how long does it take to get treatment started? So these are all things when you're starting to look at insurance funding that we would want to ask. So I wanted to share on the marketplace, we're kind of using this as an example, But I want to walk through a marketplace plan here, just so you can get an idea of money that can be going out the door. And I think this would be very helpful for you, especially if you are looking to do a child only plan through the marketplace. And don't forget, the marketplace plans through the ACA also have subsidies where the government can help pay for your premiums depending on your level of income. Okay, so make sure that so if you've lost your job with COVID and you're going to go apply for this, you could get subsidies to help you with your premiums. Okay, so this is a comparison between the Blue Cross Blue Shield Bronze plan that's offered on the marketplace and their Gold plan also offered on the marketplace. And so you can see there's a monthly premium. It is a health insurance, so there would be a monthly premium. And then you would pay that premium monthly. So that comes up with the dollar amount there for the 12 months of premiums. So in-home, it's very interesting on the Gold side here. In-home treatment services such as ABA has an 80% copay when the service comes into the home. 80% co-insurance, I should say, which is very expensive. And then, but if you go to a clinic setting, it only has a $15 copay for the day. Okay. So these are why you got to look at the plan and see what they do. There's deductibles, right, that would have to be met. And there's also out-of-pocket maximums for the year. But then when you go down to the total of the year, and again, I'm just going to stay on the Gold side here, in-home services can cost around $13,000 a year between your premiums, your co-insurance, your deductible, and out-of-pocket, and so forth. Where if you actually go and get ABA in a clinic setting, it's calculated different under the plan, and it's only $8,500 when you go to a clinic or to the office. And there's a little calculation there. So it's really interesting. I just want to make you aware, if you are looking about doing some intensive ABA treatment, it can get costly, and you may want to look at the Blue Cross Blue Shield Gold plan and do it at a clinic setting, because that's where we found a lower out-of-pocket cost for families in a year. Okay, so this would be similar to what we see, in commercial insurance, right? Where we have premiums, we may have a co-insurance or a copay, we have a deductible, similar to this. And obviously these are dollar amounts that match somebody getting, I think, did they say probably 30 to 40 hours of ABA treatment in a year. Okay, so just want to kind of throw this out at you here so you're aware of money that can go out the door. So when money goes out the door, that's stressful, right? And so I thought we needed a Zen moment here. Remember, we were talking about how I've been trying to eat more fruit. Fruit is colorful, and it just is so colorful during these wintry months. So we need a minute to take a breath. But what's great is we do have help, right? So this is a list of financial supports that I keep on my website that parents can try to tap into to see if they can qualify. Are there any monies available for grants to help pay for either premiums or co-payments? Of course, we have the Chicago Autism Network right up there at the top. There's some other ones there. And so it's really important that, we're educating people we know, maybe the companies we work for, to say, hey, hey company, could you give $1,000 to the Chicago Autism Network and really support families with autism? Because as you can tell by that previous screen, making premium payments, deductibles and things like that can get expensive. So we need more and more of this type of support in our community to help our families for sure. All right, so let's talk about, when we're who can access an insurance benefit, right? So somebody would need to be eligible, right? They would have to, in regards to at least autism treatments, they'd have to have a diagnosis of autism spectrum disorder. And then sometimes autism can be defined a little differently, services defined a little differently. And maybe they may ask for different paperwork to show the diagnosis. And we'll talk about that paperwork here in just a little bit as well. But what will happen is some clinician, some licensed clinical professional is going to have to do a clinical diagnostic evaluation on your child that would diagnose your child with autism. And then that's what would be used. And then at the end, they'll make some sort of recommendation or prescribe a treatment. And then that's what you would be taking to your health insurance. We find more and more health insurances are asking for like a physician, actually. So, if you go to a licensed clinical psychologist to get your diagnostic evaluation, you may still need to go to your primary care physician to say, hey, the psychologist has diagnosed my child with autism. I now need a prescription for this treatment she's recommending to me, OT, PT, speech, ABA, counseling, social skills group, things like that, and get a actual prescription from the physician. So then you would need to give the provider, right? The provider of the treatment services, here's my diagnostic evaluation, here's my prescription, and then they would work with your insurance company to check your benefits, find out what your benefit level is, and go from there. So, and then it's always important to make sure that the providers you're working for are in network with your insurance. So you're paying the lowest amount deductible copayment coinsurance as you can, because out of network providers, unfortunately, can have a higher cost in the long run for families. So let's talk about medical necessity, because this is really important for us parents to understand. I'm a parent of services, and it took me a minute way back when about this. So it's very different than when we apply for maybe services from developmental disabilities or our school district and things like that. And again, remember, it's kind of that terminology that it's not fluffy, it's not nice, it's not ability focused, right? So we need to keep that in mind as well. But medical necessity, to meet medical necessity as an insurance funded treatment, whatever that treatment is you're going to receive has to be evidence-based, right? Generally accepted in the world for treatment for that disorder. And the goals of that treatment is going to be to remediate deficits, those signs and symptoms of the condition that can be treated. And then those treatment plans need to be very specific, right? How is the treatment going to be delivered? How often will the treatment be delivered? What is the intensity? What is the entire duration? And what's discharge planning look like? So those are kind of good elements of what we see in when insurance are going to fund some kind of medically necessary service. But medical necessity also refers to, we kind of see these general definitions in both public and private insurance is, the treatment, again, needs to ameliorate or manage the symptoms of the disorder, right? So it goes back to the idea you're making treatment progress or you're maintaining functioning, right? Improving functioning is my next dot there as well. And of course, it's always to prevent regression, right? Where the symptoms are coming back, or what they say a lot in the mental health world in this terminology, deterioration. So just know, this is what we're looking for. This is how rigorous it is to get treatment funding through insurance. They have to meet medical necessity guidelines to be able to be insurance funded. All right. So let's talk a little bit about applied behavior analysis. I'm sure many of you have heard of it, but just in case you haven't, applied behavior analysis stems from behavior analysis, which is the science of human behavior, animal behavior, all behavior. And applied behavior analysis is used in big corporations to organize I lost it. Organizational behavior management. We use it in autism a lot. We use it in casinos, right? Casinos use applied behavior analysis. They want people to spend more money. We use it in diet and fitness and sports medicine and so forth. So it's a well-rounded behavior science, but we use the applied behavior analysis side of it for individuals with autism. So we're trying to increase positive behaviors. We're trying to reduce those challenging behaviors that really limit their ability to get in the community and be safe and so forth, teach new skills, right? And something that's really going to promote communication and functional skills for them. So we were excited that recently the American Medical Association, the AMA, has approved new permanent CPT coding for applied behavior analysis. In the CPT codes, it's called Adaptive Behavior Services. So this was a big deal for applied behavior analysis in regards to autism to get their own new permanent CPT coding that professionals and practitioners, when you go see them, code on their medical billing for you. So let's switch a little bit and let's talk about what's going on with Illinois Medicaid and ABA specifically. So the benefits started November 1st. However, We have been working to get providers trained, credentialed, and enrolled in the Medicaid program. And we were lucky our coalition got to team up with HFS, with the Department of Medicaid, to offer that training. We just did that last week. So the benefit is there, but we're still moving forward, getting our providers moving to get access to it. So what's important to understand about Medicaid, if you have Medicaid or your loved one with autism has Medicaid, to understand what type of Medicaid you have. You either have Medicaid managed care, Medicaid, which means you probably have a hard card. And then we have Meridian, Youth Care, Blue Cross Blue Shield, Community Plan, Aetna, which used to be Alaya Care, Molina, and County Cook. Okay, so those are the managed care organizations in our state, and most people are on a managed care. However, there are some kids still on fee-for-service Medicaid. You probably receive a paper card each month. So some reasons that kids are on a fee-for-service Medicaid would be they're on a spend down program first. They have somebody in the family has cancer. The child is a Medicaid eligible child, but they also have employer-based insurance that would put them on fee-for-service, or they have a Medicaid waiver. And people that have a Medicaid waiver have the option either to go to a Medicaid managed care plan or to stay on fee-for-service Medicaid. And it's always important to know that Medicaid is always the payer of last resort. So if you have any other health insurance plan, that will be billed first, and then Medicaid would be the payer of last resort. All right, so just like commercial insurance, we're going to talk about this in the Medicaid lens, but just same for commercial insurance, right? A physician, somebody has to order that you or prescribe that this child needs access to applied behavior analysis treatment, okay? And usually those orders are available for 1 year. Then you would also need to have that diagnostic evaluation we talked about, right? Where somebody like a clinical psychologist has done evaluations on the child. They've done all the state-of-the-art testing. It's pretty involved, and they make a diagnosis of autism. If that diagnosis report that you have that diagnosed your child with autism is probably more, if it's older than 5 or 6 years, you may need to get an updated diagnosis. And an updated diagnosis could be the ones you see listed here, 1 through 4. It starts with the ADOS, the Autism Diagnostic Observation Schedule. You may need to get an updated diagnosis. But if your large diagnostic evaluation isn't super old, that they may take that, and then they may just want some sort of documentation from a licensed clinical psychologist, psychiatrist, somebody to say, well, here's the relative challenges and symptoms that we're seeing right now. So the diagnosis is still good. So unfortunately, in commercial insurance, every 3 years, they require one of these 4 assessment tools to reaffirm that the child does have autism. But the great thing we're hoping to see is some advancement through treatment, right, on their scores and their outcomes. And then normally, just in commercial and in Medicaid, when you would submit the behavior analyst, right, the board certified behavior analyst, or you may know them as BCBAs, they'll do an assessment on your child. They'll write a treatment plan. They'll say, okay, we think the child needs 10 hours a week. They submit a prior authorization to the insurance company, and they either approve it or deny it. If they approve it, you usually get a 6-month approval. So treatment can occur for 6 months, and then you do another prior authorization for the next 6 months. Okay. Now, unfortunately, in the Illinois Medicaid, we have some significant barriers right now. Okay, and most of these barriers are around the practitioner types that Medicaid approved to do and to provide a ABA, or applied behavior analysis treatment, to Medicaid eligible consumers. So as we know, behavior analyst, the board certified behavior analyst, is normally who is doing this service. They are the largest service practitioner that we see in commercial and public insurances throughout the country. Unfortunately, when Illinois Medicaid created their program, they said, well, the person can be a behavior analyst, but they also have to be dual credentialed as a licensed clinical psychologist or a licensed clinical social worker. And when they did that, guess what? We only have 26 of these practitioner types in the entire state. And a lot of them are in academia. So maybe we have 14 to 15 that are actually practicing and serving people with autism. So, and the behavior analyst, this dual credential person, is the one who's in charge of designing, creating, monitoring, supervising treatment. And so they can only have so many cases on their caseload. So you can see where we have a very severe shortage of the approved practitioner types who can provide applied behavior analysis services in the Medicaid world. And so we are really encouraging families, and you can reach out to me if this happens to your family. If you try to get connected to one of these approved practitioner types and you're put on a long wait list, or they say, hey, I can't take any more cases, and you can't get access, we really need to inform Medicaid about these challenges so they can really get a good understanding of what is happening in our community, in the Medicaid community, that is trying to access these very serious and prescribed treatments. And again, we've never had access to them. So, we've had commercial insurance covering through our autism mandate for 10 years now. People with Medicaid have not had access to ABA. So this is really an important time. And, so we would definitely encourage families who cannot get access to file complaints with Medicaid. So we can really we're just trying to educate Medicaid, right, on what is really happening out in the community. The other thing is the Medicaid reimbursement rates are extremely low. So I know that's a provider problem, but the problem here could be if the provider deems they're so low, they won't cover their costs, they're not going to provide the benefit. And again, that is a barrier. But I think as a family, I would just tell we're just really telling Medicaid, hey, listen, there's this narrow practitioner type. I can't find one. I need help. Okay. So that's what's important to know there. Another thing to know is when we're trying to access these insurance services, especially mental health services, there's something called mental health parity law. And this provides protections to people with mental health disorders. Because let me tell you what used to happen in the past with individuals seeking mental health services was just terrible. A lot of times they would be forced to choose providers that were out of network. So guess what? That drove up their co-payments, their deductibles. It was terrible. Cost them a lot of money to get access to treatment services. They had stricter medical necessity criteria. And so what I'm comparing this to, as you can kind of tell from my little my scale there, is mental health services and patients need to be treated the same as they are on the medical side. Medical surgical side patients need to have the same rights as people seeking behavioral health, right? Alcohol and drug treatment, mental health services. Everybody needs to be treated the same. And in the past, they weren't. Mental health people were discriminated against, forced out of network, higher co-pays, or the prior auth process to just try to ask for the benefit would be just too lengthy. So we're really happy about the mental health parity law. And we're also very happy that in the state of Illinois, they have recently strengthened their mental health parity law, expanded the diagnoses that are protected, and autism is now protected there as well. So, if you're coming into any challenges getting access to treatment, you can say, hey, well, listen, there's this mental health parity law. I know autism is a mental health disorder. I feel like my child would have some protections to get access to these prescribed treatments from his physicians and licensed clinical professionals. So what do you do if your prior authorization requests for treatment services are denied? And one thing to know is that not everybody who's getting applied behavior analysis or ABA gets 40 hours a week. That's not how this works now, right? The behavior analyst, the board certified behavior analyst, will do an assessment. Based on the assessment and the needs and the treatment plan, that determines the dosage of hours a week of applied behavior analysis. So we see people now that get 8 hours a week. That's kind of like a focused ABA intervention. Something that's like 20, 25 hours or less is kind of a focused ABA treatment. But then we also have kids getting comprehensive ABA treatment, where that's like from 25 hours to 40 hours a week. So just know, if you're seeking ABA and anybody's told you, oh yeah, that's 40 hours a week, it's not. It depends on that individual's needs. And along with that comes parent training, and insurance companies pay for the parent training, which is fantastic. So just know it's a spectrum, right? Just like autism is a spectrum, so is the dosage amount of applied behavior analysis. So we still see some people get denied services, right? So we want to work through those denials. And so we would need to probably file an appeal. Sometimes you're denied access because of age. They say, well, ABA is really not effective over the age of 12, but it's highly effective. It actually started with adults and had great clinical advancement, and it was brought down to serve with kids. So age shouldn't be a reason that you're being denied access. They may say, well, you're not making effective progress. Well, or enough progress. Well, remember that medical necessity definition, right? Where we're trying to ameliorate our symptoms of autism, which means we are progressing in treatment, we're meeting goals, and that's fantastic, but it also maintains stability. And plus, think about all the things that can disrupt our kids, maybe during a 6-month authorization period of advancing in treatment goals. Mom and dad got divorced, somebody lost a job, a grandparent passed away, we lost our home, we haven't had enough food. I mean, these are all things that really can impact. Maybe we lost our behavior analyst, and now we have a new one. It's just taking a little time to ramp up. These are all things that may disrupt treatment progress. And just because somebody is not making treatment progress doesn't mean they should be discharged, right? Especially for somebody like I was telling you about my son, Eli. I don't think I told you, you could probably tell on the picture, my son is 6'8", about 270 pounds. I mean, he's like LeBron James size. I love the NBA. So I watch a lot of the NBA, and I'm from Ohio, right? So that's a big guy. And if you're having any challenging behavior, aggression towards other, property destruction, that can be very dangerous. So, sometimes you are just maintaining stability. And so we want to fight back when we talk about not making effective progress. Just because they're not advancing on their goals doesn't mean they're not doing well. Care at this age should be transitioned to the parent or the caregiver. Wow. I don't know about you, but I mean, I've learned a lot about the science of behavior, but I can't provide treatment and supervise treatment for my son. So we don't say, and the only time they're going to transition services back to the parent or caregiver means that, oh, they've met all their treatment goals, they're doing well, we think we can stop providing intensive treatment. So parents are not clinicians. And so that is a challenge there. And the individual should be getting these services in school. Yes, schools utilize the principles and procedures of applied behavior analysis all the time. We use them as parents, right? And we're disciplining our kids. We use them everywhere. But there's a difference between medically necessary prescribed treatment of applied behavior analysis that needs to be provided by a qualified healthcare professional that the American Medical Association has now approved. So sure, these kids can get some of this treatment in school, but they all cannot. And if they say you can't do ABA treatment during school hours, okay, that doesn't work either. When my son was in crisis, he couldn't go to school. He was not safe to go to school. I needed to access treatment services during the day, or how else was I going to stabilize him to get him back to school? Okay. So you'd want to file an appeal with the healthcare insurer and try to solve that way. And sometimes that can be done. You could also, if that doesn't work, you can file external appeals with the insurance company's regulator. So self-funded plans, right, those big, large plans, that would be the U.S. Department of Labor. Fully funded plans would be your state insurance department. The ACA plans or the Get Covered Illinois marketplace plans would be your Department of Insurance as well. And then, of course, Medicaid would be the Medicaid department, right? You would appeal to the managed care plan if you have managed care plan, or you would appeal directly to Medicaid if you have fee for service. So, and I have something down, see the EPSDT. So remember how we talked about that mental health parity law, those protections. Well, if your child has Medicaid managed care plan, they have mental health parity law protections as well. All kids with Medicaid have a protection called EPSDT, early periodic screening, diagnostic, and treatment. And so if you're denied in Medicaid from getting access to treatment for your child, say, listen, my child has this EPSDT thing that protects them, and they have mental health parity law. Help me understand why they're not meeting medical necessity to get access to applied behavior analysis, speech, OT, counseling, med-management, whatever it is. Those are protections that are there for us. Very important protections. So thank you again for coming out tonight. I hope you found a gem, right? Or something that can help you. And I want you to reach out anytime. This is my website. I have a contact page there. I have lots of information on our website, which is www.ilasd.com, which is like IllinoisASD.com. But it's really important. Us parents are sharing information, we're engaging each other, we're asking questions, we have good resources. So our website has a lot of the stuff I talked about is all on that website as well. But I'd love to hear questions that you have so we can answer and support you.